All right, so I'm Dr. Betita, and I've been tasked to lecture on occupational health and school health. By the end of this session, you should be able to identify hazards, institute measures to control hazards, and apply school health principles or models to deliver health services to schools and school-aged children. So let's start our discussion with occupational health and safety. Let's begin with the Employees Compensation Commission Manual. Okay. So, in the Philippines, as of 2024, non fatal occupational injuries occur at a rate of approximately 417 per 100,000, and occupational fatalities occur at a rate of 9.6 per 100,000. So, this is kind of high because given a population of 100 million, this would account for about 41,000 deaths approximately due to occupational injuries. Okay. So health examinations in the workplace. So in the workplace, we do examinations of workers, and the reasons why we do this is to detect early signs of illness, injury, ill health, to prevent ill health, injury, or illness already suffered or aggravated by the work environment, to ensure that workers are able to sufficiently work, and to detect a health condition of a worker that increases the risk of injury or accident. And there are different types of health examinations in the workplace. We'll be going over them one by one. So pre-employment physical exam, this is the one that you're probably most familiar with. So before you start work, you should be examined if you're fit to work. So this gives us the condition of an applicant at the time of hiring. It tells us if the worker has the physical abilities that are required to perform a particular job, and it prevents the placement of a worker in a job or occupation where they may be a danger. Okay. So class A, this particular worker is fit for any kind of work. Class B, they are physically underdeveloped or with correctable defects. Class C, employable but due to certain ill impairments, conditions require special placement or limited duty, or it may require follow-up treatment or periodic evaluation. And class D, this particular worker is unfit for any type of employment. Okay, the periodic annual medical examination, ito yung annual PE ninyo. So this focuses on health risks of employees. It follows up on previous findings. This is done for early detection of disease and to determine the effect of exposure to health hazards. Transfer physical examinations are done when an employee is transferred to either a new location of work or to a different occupation. So, this is done to determine if your worker is medically sound to perform the tasks that they are going to be doing or to go to another place of assignment. Special examinations may be done when there is undue exposure to health hazards. For example, workers who are chronically exposed to organophosphates may undergo special periodic examinations, either quarterly or monthly, in order to determine if there are increased illness due to the increased exposure. This is also true for miners who are chronically exposed to lead and mercury. They need to be regularly examined in order to determine if they are still healthy. Okay. Return to work. This is done to determine whether or not a worker is fit to return to work. So this may be either due to illness or due to prolonged absence, due to say either maternity leave or due to prolonged leave. Okay, due to vacation, sabbatical, or maybe study leave. This is done to prevent spread of contagious diseases and to reassess if a worker may continue if this particular worker has injuries and disabilities. Separation from employment. So there are two kinds here. One is to determine cause of death in situations wherein your patient had died. The second is if a patient had been disabled. Um, and the third situation is where a worker leaves employment. Okay. So death is compensable when it results from a work-related injury or sickness. Beneficiaries are entitled to benefits, and the status of beneficiaries are determined at the time of an employee's death. Where death or disability is non-compensable when the injury or the death is due to intoxication, when it is due to willful intent to injure self or others, when there is notorious negligence, or when the injury or death is not work related. Okay, so separation from employment examination. So there are three situations there. It's either the employee quit or was fired or terminated from employment, or the patient had died, or the patient had been injured and is therefore no longer able to work and therefore requires separation. So this type of examination is to determine whether or not the injuries or the death is compensable. And these are the situations wherein it may not be compensable. So compensation for disability. So injuries, deaths are work-related and compensable if they happen at the workplace while the worker is performing his or her official function, and outside the workplace but while the worker is performing an order of his or her employer, while going to or coming from the place of work, or while ministering to personal comfort. So ministering to personal comfort, kumain ka, um, uminom ka, umihi ka, nag-CR ka, or you took a personal break. Okay. Sige. So disability may be total or partial. A total disability is one wherein an individual is unable to work due to injuries or illnesses that are expected to last indefinitely. A disability is partial when an individual is unable to perform some, but not all of the significant duties of their occupation due to an illness or injury. A disability may be temporary if it's less than 120 days. Disability is said to be permanent total if it's more than 120 days continuously, and if a person's disability is such that they are unable to return to work. Permanent disability may also be any of the following: so complete loss of sight, loss of limbs at or above the ankle or wrist, permanent or complete paralysis of two limbs, brain injury resulting in incurable imbecility or insanity. So, permanent partial disability is when an injury or illness that results in the loss of use of any part of the body despite any pre existing condition. So, if you lose the function of a thumb, then you get 10 months worth of disability. So, you get 10 months leave with pay. Okay. If you lose one index finger, you get 8 months worth of leave with pay. If it's one middle finger, that's 6 months worth of leave with pay. And you may or may not return to work. Okay. Um, this will be purely voluntary, of course. And because this is permanent partial disability, they will have to, if you do decide to return to work, then your employer will have to place you inside of a job where that you can handle or that you can manage, even with your disability. Okay. So medical services, reimbursement of the cost of medicines for the illness or injury, payment to providers of medical care, hospital care, surgical expenses, and the cost of rehabilitation, appliances, and supplies according to the Employees Compensation Commission. These are all reimbursable. Okay. However, the reimbursement is limited towards services of government hospitals, and what's not included are extra charges like private rooms, appliances, or duty nurses. Okay. So medical services are reimbursable with the Employees Compensation Commission in the event that you suffer a work-related injury or disability. Okay. So hazards. Health hazards are environmental factors, agents, or situations that may create potential harm or injury to one's physical well-being. Risk is the probability that a person exposed to a factor will actually experience a specific hazard, and with increased exposure comes increased risk. And the basis for determining hazards and how to control them are from your Occupational Safety and Health Standards. This is a 1989 document from the Department of Labor and Employment. And of course, the Labor Code of the Philippines and the Employees Compensation Commission manual, which I previously discussed. Okay. So hazards may be physical, ergonomical, mechanical, chemical, biological, or psychosocial. And I will give you some examples of them, but the examples that I give will not be exhaustive. They will just be examples for citation so that you'll have a taste of what these things are. Okay. So physical hazards may be due to, and examples would include vibration syndromes, like your white finger disease or whole body vibration, and altitude, which may lead to dysparism and decompression sickness. Okay. So an example of whole body vibration syndrome. So usually, kasi when you have machinery, like say with trucks or tractors, these things have vibration. And when you're sitting in a chair, this will vibrate, and your whole body vibrates. Now the problem is that as the frequency of the vibration increases, you suffer injury actually to your skeletal system, your tissues, because your tissues are actually pulling away from one another. All right. So the vibration is causing damage through the forces kasi that are being rendered with the body. Okay. The tissues are being pulled against the bones and vice versa. Okay. So some of the health effects of whole body vibration syndrome would include speech interference, increased heart rate and blood pressure, muscle fatigue and cramping, increased breathing rate. You might have dyspnea, disruptions of balance and perception, and low back pain and damage to the spine, and musculoskeletal complaints. Okay. In the case of in the case of yung white finger disease, so this is white finger disease right here. As you increase the frequency actually of the vibration, you start to see increased damage actually to the tissues, and this is primarily due to decreased perfusion to the extremities, resulting in this phenomenon of ano of severe pallor in the extremities. Okay. The vibration actually causes vascular injury, musculoskeletal injuries, and neurological injuries. So itong white finger syndrome, this is usually seen in workers who are working with yung napapa-vibrate yung upper extremities nila. For example, jackhammers. Jackhammers, mga drills, mga saws, mga power tools. Okay. All right, so dysbarism naman, this is due to rapid changes in pressure. And we have two types. So barotrauma, this is trauma actually to gas-containing tissues in the body. So usually kasi this is seen in divers. The same is true with this dissolved gas thing, I know. Pero barotrauma can also be seen in mountain climbers, especially if the ascent is very rapid. So you may have pulmonary overpressurization, gas embolism, and the barotrauma may be localized. So again, this is trauma to gas-filled structures. And the mechanism behind it is because as you enter areas with lower pressure, these gas-filled structures like your lungs, they may expand or contract depending on the change in the pressure. Okay, with your dissolved gas naman, as you increase the pressure, the nitrogen gets dissolved inside of the blood. As you decrease the pressure with ascent, these bubbles, in bubbles of nitrogen, try to leave actually the blood. And this is what leads to your decompression sickness, oxygen toxicity, and nitrogen necrosis. So physical hazards would include heat, like heat stroke, lighting, maybe there's lower direct sunlight, and radiation from your ionizing radiation. Examples of ionizing radiation would include your X-rays and yung sa Hulk, yung gamma rays. Okay. So differences between heat exhaustion and heat stroke. So with heat exhaustion, there's feeling faint or dizzy, excessive sweating, clammy skin, nausea, vomiting, and muscle cramps. With heat stroke, there's confusion. When you reach a certain temperature, kasi you stop sweating. And when the temperature goes over 40 degrees, the skin becomes hot and dry. There's nausea and vomiting with the dehydration, and these patients may lose consciousness or experience convulsions or seizures. Heat stroke is potentially fatal, so this must be arrested as early as possible. Okay. So poor lighting. So poor lighting is dangerous because it can cause eye strain, headaches, poor posture, low productivity, accidents and injuries, and emotional and mental disequilibrium. Right? So this picture shows bad lighting. So in this picture, the light is coming from the device. So you don't want that. Okay. What you want is for the light to be overhead and the working surface should be well illuminated. So again, to illustrate good lighting ergonomics, so this is good. So you have a light source that's overhead. What's bad is if light reflects. So this causes glare, which can increase the strain on the eyes. Reflected light, similarly, it can cause glare. And yun, reflected light causes glare. You want the light to be such a way na it's not directly onto your eyes. Okay. All right. So, ionizing radiation. So this can cause death, skin burn, sepsis, sterility, and GI and metabolic complications if it's acute. If it's long term, it can cause cataracts, malformations, cancer, and circulatory diseases. So physical hazards would include noise, noise-induced hearing loss. Typically, permissible exposure to noise is about 90 decibels for about 8 hours. These are typical noise levels in decibels, decibel amperes for typical na mga sources of noise. Okay. So symptoms of hearing damage. So initially at lower frequencies, sound might seem muffled. There might be trouble distinguishing speech consonants and hypersensitivities to certain sounds. In the middle, between 80 to 90 decibels, you might have tinnitus. You might be asking people to speak louder, slower, and clearer, or to repeat themselves. And you might have difficulty hearing through the phone and in loud places. And that um, increased volume, about 100 to 150 decibels. You might have to increase the volume of the television or radio. You might have difficulty hearing high pitched sounds, and you might experience temporary hearing loss. So, these are the symptoms of hearing damage with chronic exposure to these levels of hearing. Okay. So, mechanical ergonomics, these are repetitive mechanical forces leading to excess loads, poor ergonomics, and these are your occupational musculoskeletal injuries, which include your carpal tunnel syndrome, the vein tendinitis, and low back pain. So, carpal tunnel syndrome, this is due to repetitive motions at the level of the wrist. Okay, so in carpal tunnel syndrome, there's impingement of the median nerve due to inflammation at the level of the carpal tunnel. So the median nerve passes through the carpal tunnel. When it's impinged, it causes the symptoms of carpal tunnel syndrome. And carpal tunnel syndrome is diagnosed through either the Phelan test or the Tinel test. So Tinel test, you tap the median nerve and it produces an electrical-like pain in the hand, radiating outward towards the fingers. With the Phelan's test, you perform this maneuver and that will also elicit pain. Okay, so the pathophysiology of carpal tunnel syndrome is related to nerve impingement, and it's usually due to inflammation at the level of the flexor retinacula. Okay. The vein tendinitis naman is due to inflammation of the two tendons that control the thumb. So this can be diagnosed using the Finkelstein maneuver, which is illustrated here. So you simply make a fist like so, and you deviate the wrist down. This should cause pain dito sa tendons. This is usually commonly seen in people who write a lot. Okay. So chemical hazards include solid, liquid, and gaseous substances. And sources of chemical hazards include particulates, which are solid particles or liquid droplets. If you've been to Korea, yung fine dust na sinasabi nila, that's an example of particulates. And these are particularly dangerous. Okay? Yung fine dust na yan can cause lung pathologies. So gases, including aeriform liquids, which have neither shape nor volume. So examples would be things like benzene, toluene, yung mga hydrocarbons, yung mga organic fumes, etc. Vapors, these are gaseous forms of substances which are normally liquid or solid. And usually, kasi when we deal with chemical hazards, we are looking at the threshold limit value. So threshold limit value is the maximum airborne concentration under which all workers may be repeatedly exposed without any adverse effects. So examples of chemical injuries would include irritative contact dermatitis. So when the chemical touches the skin, it causes irritation. Allergy and atopy, occupational asthma, silicosis and amyloidosis. This is they form deposits actually in the lungs. This can sometimes be mistaken for tumors, and of course chemical burns. All right. So health effects of mercury exposure. So short-term effects include impaired hearing and vision and speech, tremors, lack of coordination, skin issues, and difficulty in chewing and swallowing. Long-term effects of mercury exposure would include weakness, fatigue, anorexia, weight loss, disturbances of gastrointestinal function, and deterioration of the nervous system. All right, so organophosphate poisoning. So this is actually common among farmers. So organophosphates are actually your pesticides, and they primarily work by um, stopping the acetylcholinesterase. So acetylcholinesterase is an enzyme which inhibits the your acetylcholine, okay, thereby causing overstimulation through increased uptake of your acetylcholine. So there's too much acetylcholine. Okay. And acetylcholine has two effects, either muscarinic or nicotinic. So, pag muscarinic, this is your sludge, your salivation, lacrimation, urination, defecation, GI cramps, emesis. Kapag nicotinic naman, yan yung tension, weakness, and paralysis. You will go over this again when you go to your autonomics. All right? Biological would include your infectious diseases like your TB, malaria, hepatitis, and HIV, and of course, exposure to human and animal fluids. So hepatitis B is primarily transmitted through sexual transmission, pero it can also be transmitted through exposure to any infected blood and bodily fluids. So unlike HIV, hepatitis is 100 times more hepatitis is 100 times more infective than HIV. Okay. Another example would be your anthrax. Anthrax is typically found in agricultural workers. So it may enter the body through cutaneous spread, through ingestion or inhalation of the anthrax spores. And the anthrax spores typically come from your farm animals. It may exist either in the soil from the droppings of infected farm animals. It may also be found in the fur of farm animals, in particular mga sheep, yung mga wool ng sheep. Um, it may also be found in animals' waste and when they decompose into the soil. And this is what anthrax bacilli looks like, and this is what the anthrax disease looks like. Okay, so it can cause sores and infection that spreads very rapidly. All right. So HIV, this is typically transmitted through contact with bodily fluids. Like I said earlier, hepatitis B is 100 times more infective than HIV. Primarily, HIV is transmitted through the use of non-sterile syringes and tools. It can be transmitted feto-maternally through blood transfusion, organ transplant, unprotected sex, and exposure to generally to bodily fluids. All right, safety. Unsafe working conditions involve spills, obstacles, heights, machines, and electricity. And we have the zero accident program in your drug-free workplace. So safety, mga spills, accidents, etc. So this is primarily prevented through early warning signs and through the mitigation of your spills by cleaning, etc. Psychosocial would include sexual harassment, victimization, stress, and workplace violence. And control of workplace hazards is primarily done through isolation. So kapag isolation, um, you are placing a distance between the hazard and the susceptible host. So an example of this would be transporting waste at night, which would decrease exposure to waste among the general population. Okay. Or, for example, placing a barrier between the hazard and the people, the workers. Okay. Substituting a harmful product or a harmful substance for a less harmful one. So, for example, substituting normal gasoline, which is high in lead, with unleaded gasoline. So, shielding, you are placing a barrier. So that's lead aprons for X-rays. Lead aprons will prevent X-rays from hitting the body. Treatment, you are effectively eliminating the hazard. An example of that would be sewerage treatment, because the sewerage will contain a lot of biological hazards. So when you treat it, you eliminate the biological hazard. And prevention, through the use of yung mga preventive interventions natin, prophylaxis and immunization, right? So these are our different controls. So personal protective equipment at the bottom, administrative and work practice controls. So administrative and work practice controls, these are policies. Engineering controls, these are mga measures that are put in place in the workplace. So this might have to do with, like, say, the manufacturing process itself, etc. And the elimination substitution, you are eliminating the exposure before it can occur, or you are substituting the harmful substance for something else, or you're completely eliminating the hazard. Okay. All right, school health services and programs. Students with higher grades are more likely to eat breakfast on all 7 days, eat fruit or juice, 100% fruit juice one or more times per day, or eat vegetables one or more times per day, and to not drink soda. Students with higher grades are also more likely to engage in physical activity, play on at least one sports team, and less likely to watch television for 3 or more hours a day, or play videos or use a computer 3 or more hours a day. Okay. Students with higher grades are less likely to have had their first drink of alcohol before the age of 13, currently drink alcohol, or currently binge drink. Students with higher grades are less likely to vape or use an electronic cigarette, smoke cigarettes, or use smokeless tobacco. And lastly, students with higher grades are more likely to have 8 hours of sleep and less likely to have never seen a dentist. Okay. So, school health involves the integration of wellness, safety, growth, learning, and development in the lives of school age children and adolescents in the context of their school and with a coordinated alliance of the family and the medical home. This is according to the American Academy of Pediatricians. So, school health is composed of three critical areas, namely school health services, school health education, and school health environment. So, no matter what model of school health that we use, these three critical areas are always present in those three models. Okay, so I will be showing you three models of school health and also the Philippine situation of school health. Okay, so child-friendly schools is a model adopted by UNICEF. Um, it was started by the DepEd actually as the School Health and Nutrition Center, and it's focused on the school age child. It covers safety, security, nutritional status, and the psychological well being of the child. And it includes appropriateness of the teaching methods and learning resources, and it's an intersectoral approach which involves the wider community at large. So, child-friendly schools, the focus is on improving water supply, promoting good hygiene practices, addressing nutritional needs, increasing access to energy, and addressing challenges posed by climate change, namely disaster risk reduction, preparedness, and response. Health promoting schools naman is a model that's advanced by the WHO in 2003. So this is a more holistic definition of health, and it has six key features, which I will be discussing one by one. This is engaging health and educational officials, teachers, parents, students, and community leaders, safe and healthy environment, skills-based health education, access to health services, and health promoting policies and practices, and improving the health of the community. So engaging health and education officials, teachers, parents, students, and community. This basically focuses on engaging the community at large, including the teachers, parents, education officials, etc. Safe and healthy environment. This is more about sanitation and water, freedom from abuse environment, a climate of care, trust, and respect, social support and mental health promotion, safe school grounds, and opportunities for physical education and recreation. School-based health education involves a curricula that improves student understanding of factors that influence health and include critical health and life skills, and training and education for teachers and parents. Access to health services, this should be self-evident. This implies health services like screening, diagnosis, monitoring, growth and development, vaccinations, selected treatments and procedures, partnerships with local health agencies, and nutrition and food safety programs. And of course, health promoting policies and practices. So this is mga overall health policies supported by the school administration and management, policies on equal treatment for all, and policies on drug and alcohol use, first aid, violence, and the reduction of physical and emotional and social problems. And of course, improving the health of the community. So, focusing on community health concerns and participating in community health programs. Okay. Coordinated school health naman, uh, this is the model that's being proposed by the CDC. So it has 8 components similar to earlier. So health education, physical education, health services, nutritional services, counseling, psychological and social services, health promotion for staff, family and community involvement, and healthy environment. So medical and dental services in the DepEd were nationalized in 1960. This began with the School Health and Nutrition Center of the then Department of Education, Cultural and Sports in 1977. In 1997, they started the Integrated School Health and Nutrition Program of the Department of Health. This was different from the Department of Education. And all schools in the Philippines are required to have a school clinic and a dental unit. We have two societies, namely yung Private School Health Officers Association and the Philippine Academy of Physicians and School Health, which um, kind of sila yung societies na sumusulong sa school health in the Philippines. Okay. So One Health Week, this is a program of the Department of Health. So this was first done in 2021. This is nationwide simultaneous inauguration of medical and dental clinics, launch of dental health programs, school-based feeding program, comprehensive sexuality education and adolescent health convergence. Adolescent health convergence, this is like the entire gamut of adolescent health. So this includes mga risky behavior prevention, sex education, drug abuse prevention, alcohol abuse prevention, lahat yan pinagsama. Okay? Including mga menstrual education services for girls. Kasama rin dyan, I'm actually not sure kasi kung meron na tayong transsexual education, pero kasama dapat yan under adolescent health. And also specific concerns for LGBTQI youth. Okay, webinars on school health, mental health initiatives, and National Suicide Prevention Day and National Drug Education Programs. So the DepEd has several programs under school health. So WASH in schools. WASH is water, sanitation and health in school, and it's water, sanitation and hygiene in schools. So this covers everything from hand washing to washing your hands to basic hygiene. Okay, school-based feeding programs is primarily nutrition, adolescent reproductive health, which I just described kanina. So this is primarily aimed at reducing mga risky behaviors in adolescents. National drug education programs, COVID-19 response, tobacco control program, early childhood development in pediatrics. This is primarily concerned with growth and development, integrated school nutrition model, and yung OK sa DepEd. So OK sa DepEd, this is Oplan Kalusugan. This involves height and weight screening, Vision screening, this is done at kindergarten, grades 1, 4, 7, and 10. Auditory screening at grade 10. Consultation and treatment. Oral health examination and dental treatment. Dental treatment actually includes non-traumatic, uh, atraumatic treatment of dental caries. So yung mga filling, yung mga pasta. Referrals, other health services as needed. Immunization with measles, rubella, tetanus, diphtheria at grades 1 and 7. And for girls, HPV immunization at grade 4. And WIFA is weekly iron folic acid supplementation for female learners. Okay, so future developments, PhilHealth coverage for outpatient health needs, a separate commission on school health, hopefully magkaroon tayo ng ganyan. In the organizational chart of the school system, school health officials are under the head of the school. Standardization of the school healthcare system and certification system for specialization. We actually have a certification system for specialization now through the Philippine Academy of Physicians in School Health Incorporated. So this one is a society na meron ng course for doctors who wish to practice school health. All right. Sige. So thank you. Have a nice day.